afternoon to all guests, delegates, and everyone present here. I, Tejaswini Bojappa,
And I, Sanjana Garimella,
of MBA Hospital and Healthcare Management from Symbiosis Institute of Health Sciences, are delighted to be the host for. Delighted to be the host for the session, and the topic is Violence Against Healthcare Providers, Judicial Pronouncements. Considering our current situation, healthcare workers are working endlessly, and it is the moral and legal duty to protect the healthcare workers from the violence they are facing. Violence against healthcare workers is unacceptable. It has not only a negative impact on the psychological and physical well-being of the healthcare staff, but also affects their job motivation.
sir, is a medico-legal expert. Dr. Sanjay Gupte has been in the clinical practice for more than 39 years and has been identified as a senior icon and a penultimate idol by the practitioners in his profession. Sir is the Secretary General of the World Justice Organization. He is a director at Green Array Genomic Research and Solutions. Sir is a chairman of the Committee for Ethical and Professional Aspects for the Human Reproduction and Women's Health under the International Federation of Gynecology and Obstetrics. Sir has more than 150 publications in his credentials. We are very honored to have you here today, sir. I would like to request Dr. Sanjay Gupte, sir, to come up onto the dais and address the audience.
So now from something intelligent, we are going to go on to something social. And I hope that after this talk, you don't wish that all the doctors should really be replaced by artificial intelligence. Right. So, we are having an epidemic of violence, as you know, everywhere. And this is a global phenomenon. Not only in our country, but everywhere else, the violence against doctor is increasing. Right. Okay. So for this talk, I've taken, we'll go through all these things, the trends, violence against healthcare professionals, causes of violence, effect of these trends on society and healthcare, steps to avoid violence, prevention and interventions, and finally, can there be a legal deterrence? Can we do something about it ourselves? I think the need is definitely there now. Okay. Yeah, I think I'm finally getting it right. So this is the material that I have gone through. If anybody else wants to refer to these things, there are lots and lots of things, a lot of legal cases also. There's no dearth of the matter here. But this is what we see every day, in the newspapers, on TV, everywhere. And this was one of the sad happenings. And look at this, every day if you open the paper, somewhere you will find all these issues, the doctors being assaulted, practically from large institute to smaller places. And just imagine, this is in JJ Hospital, Mumbai, the residents were attacked. This is, in Dhule Hospital, this is what happened. Then again, a lot of pictures from, other places. In Tuticorin, patient's husband actually, a very senior gynecologist, was literally hacked to death with, after the patient died. Yeah, no problem. That will be better, in fact. Okay, can you hear me? Okay, fine. So that makes it easier. Right. So, and of course, one of the recent happenings here. Then this is a very, very recent happening, like in last a month or so. In patient died of PPH, and this is what the doctor had to suffer. And again, this is the latest that's going on everywhere. She was a young gynecologist, a gold medalist. She decided to work in a village near, Dausa, Rajasthan. And again, patient died due to PPH. And the relatives were okay, but, a lot of political leaders came with, and made a lot of halla-gulla, and finally police put her 302, FIR, and she got really worried and scared and committed suicide. So these things are very, very common, and we need to really think about it and think what we can do about it. So if you look at various studies, in our country, frankly, there are not too many studies, but this is a good IMA study, it was done. And what they found was 75% of doctors in India faced at least some violence, 75% mark you. So majority. So if you're not faced so far, you're lucky, so think of that. Okay, then nearly 50% of such violence is reported from intensive care units or post-surgery. Right. Then look at AIMS, the most prestigious institute. This also stands here. Also, it stands at one of the top 10, and there's no surprise because the government hospitals, unfortunately, bear the brunt of due to various situations that we'll be discussing. But what is different in India compared to other countries, and this is what it is. Well, you will have in US, America, there will be patients who will attack doctors, but usually that is due to personal issues and personal aspects and all that. But what happens in India is dramatically different. Here the patient, generally patient himself or herself are okay, the relatives, immediate relatives are okay because they've seen what's happening, what the doctor has done for them. But the violence is by other groups and often involving distant relatives, unrelated people, local political leaders who often call themselves as social workers, and they take law in their own hands without, and this is important, without any fear of reprisal from any authority. And that's what is happening now. And when in small towns this thing happens, just imagine, suddenly a spontaneous group of 100, 200 people comes, make a whole crowd and threaten the doctor, create violence. And what the hapless doctor is going to do? And the media is already there, for the sensational coverage. And our politicians, they are always behind the doctors, absolutely always. So, but this is the way they are behind the doctors, as you can see. All right. The sad part is Indian mob has no fear of any action, retribution, punishment from police and other government authorities. We did a study, this Karnataka Law Commission study, and if you see, hardly any FIRs were lodged, and if at all any FIRs were lodged, they were not followed, and there was hardly any punishment for any of the doctors. Same thing, this MLAG, Dr. Neeraj Agarwal, he works very diligently for the doctors in Punjab and all these places. He has his MLAG group, Medico-legal action group, and he asked under RTI this for what happens. 8 years the Punjab had a law for violence against the doctors. What happened? Most of the complaints were not registered as per FIR. Whenever they were lodged, later on, due to whatever reasons, there were compromise reached, and that's why among the parties, and the case was not followed. And finally, in 8 years, there is not a single person who has been actually punished under this act. What about our doctor-patient relationship in our country? Well, the infractions we have seen that occur everywhere nowadays, the road rage and everything everywhere. But the doctors are always soft target. And the people instigating they take the law into their hand. And the simple excuse is, if you don't do that, then who is going to punish the doctors? Doctors are well connected, they'll get away, and that's the, one of the reasons that's given. And of course, they know that nothing is going to happen to them, nobody is going to punish them. And less said the better, the breaking news, hungry Indian media, they're rushing, before even the violence occurs, they're rushing, accusing the doctor, holding the doctor responsible. And we have seen that daily happening, especially regional news, you will find at least every day some such thing happening around here. Right. Mob for hire. This is again a peculiarity of Indian situation. I was in Ludhiana once, and I went around. I went for a lecture there and saw boards that Bharatis on hire. I've seen that because there a lot of in our eyes, the boys and they come from abroad, and just a small family comes, but the wedding has to be really a big wedding. No? So Bharatis have to be there. So there are Bharatis on hire, and everybody, all shopkeepers, everybody, they close down their shops at around 8:30, dress up and go as Bharatis, and then, enjoy the wedding, have their food and go back. So, and they get money for that also. So here also, unfortunately, this one particular, family found that this is a good business, and they, in Calcutta, they were finally caught, doing this. So, bad roads, accident, patient dies in the hospital, hit the doctor. Well, bad items, food poisoning, patient dies in the hospital, beat the doctor. Okay, bad heart, liver, patient dies in the hospital, again, hit the doctor. No money, but doctor should serve free, so hit the doctor. Again, bad train accident, patient dies in the hospital, hit the doctor, and dirty dengue, child dies in the hospital, again. The solution is single, let's hit the doctor. Child dies in the hospital, asthma, everything, yes. And complicated case, again, child dies, simple, hit the doctor. All right. So we are those who will never question our politicians, never hit corrupt babus, never hit corrupt businessmen. We are the ones who only hit the doctors. And so can somebody suggest a doctor who can help this ailing society? So, well, causes of violence, there are many causes of violence. We have to heed to some of them, and we have to look at these. And, well, basically we are regarded as, in past, it's a cliche saying as gods. But of course, amongst us also there are people who are extremely business-minded, and though they are small in number, but they create a very bad impression amongst the patient, and that's probably one of the causes that we have to accept. But again, sensationalization of news items. Well, there are self-proclaimed social advisors, who advise us that, lecturing on generic medicine, you remember that, Satyameva Jayate. And now they advertise for brand medicine, because they get paid for it, and they call themselves social advisors, So again, especially when it comes to, capacity of the government hospital, the situation is pretty bad, availability of drugs, including life-saving drug, diagnostic equipment, staff shortages. So a lot of complaints are generated. That's why I think government hospitals bear the brunt about this. Okay. Healthcare budget. We know that hardly 1.2 of the GDP is being used, which I think in spite of COVID, unfortunately has not improved, and that's why the conditions remain pathetic in many of the government hospitals. Then if you see the small places, the small hospitals in India, cover almost 84%, of the, 84% are small hospitals, and they give 33% of healthcare expenditure is from government sources, and all remaining is out-of-pocket expenditure. So out-of-pocket expense of our healthcare pushes many households into poverty all over India, even though these are more affordable than the corporate hospitals. But still that creates friction, at many places. Lack of faith in judicial process. Again, because mainly not because the judiciary doesn't work, but it is slow. And that's why people always feel that, whatever I do, if I go to the judiciary, I may get justice, but it may take years, and that creates, trouble. Mob mentality is there, emotional turmoil, and not only emotional turmoil with, as I said, so-called leaders creating problems, but, if the death of a patient is sometimes given religious and caste color by some miscreants, especially if the doctor belongs to different caste or religion, that again is very particular of our country. Low healthcare literacy, yes, very much so, because how do you explain the patient certain things? Their understanding sometimes is so less that it's difficult to get across, and their what we call andhashraddha is so much that it's difficult to go through that and explain the patient something like this. What would a cardiologist do in this situation? Then अनरियलिस्टिक एक्सप्रेशन डॉक्टर कुछ भी करो लेकिन हमारा पेशेंट ठीक होना चाहिए कुछ भी कहे दैट्स द यूजुअल थिंग दैट इज यूजुअली said by the relatives without knowing that what the condition of the patient is, and then it happens severely anemic patient reaching hospital only for the delivery and dying of PPH. Who is responsible? You can't hold the doctor responsible in this situation. Cost of healthcare, though the costs are much less compared to any other country, and now we know this is the season, when the holiday season and then December season, where all our great NRIs rush to India for treatment, because they have holidays there, and the treatment is much cheaper here. So so many dentists, many of the practitioners have become clever now. They don't take holidays, during that time, because so, right, okay. So inadequate insurance cover. There's hardly any insurance, cover in a private setup for the private patients, which needs to be improved. Poor communication. Now, this is something that we need to work on, and we have to heed to that we are still many times paternalistic. We tell the patient what the patient is supposed to do. We have to actually learn to respect the patient, understand the patient, and explain. Many of the places I've seen, especially in large places, because there is dearth of time, and that's why the detailed discussion never happens. The instructions are given, and the doctors expect the patients to follow the instructions, without any questioning. That is not going to happen anymore, even in public setups, and we have to learn to heed to that. And so caregivers must be trained in breaking bad news. Again, that is something very, very important. It's always a dilemma. If the patient, there was one. This was a long time back. The patient was brought to my hospital at 2 o'clock, who fell down in the house. She was pregnant, but some fell down in the house, in the bathroom, and nobody apparently came to know. By the time they came, realized that this is happening, they broke open the door, brought the patient to the hospital. The patient was dead by the time she was brought to the hospital. Now, what do we do? If you explain to them suddenly, oh, you brought a dead patient, again, there can be a reaction, violence. If you don't tell, and you try and do something, and then the patient dies, then they will say, oh, she was alive when the patient was brought. Now, now the patient is dead. So it's in these situations it becomes difficult, and we have to have a drills exactly in what situation, who is going to say what, and we'll discuss a bit about it a little later. Lack of security, especially in small hospitals, is difficult nowadays to budget for. Even the nurses and the doctors, leave aside security. So security is always an issue in small hospitals. Quality of primary care, again, we are all rushing to become, specialists. And so naturally the primary health care is lagging. The government is now trying to work on it, wellness centers and all, hope that sometimes it will happen. So that if the primary care is good, naturally the tertiary hospitals will not be loaded. Believe me, there was time when I gave a presentation to the National Health Council. This was about 10 years back. And then they decided, oh, this is a good idea, that most of the deliveries should occur. And this was in front of, Health Minister, then Prime Minister, and all that. And they said, okay, this is a good idea, we should shift to institutional deliveries. And then they came out with ideas like that JKS scheme, if you come to the hospital for delivery, you will be paid and all that. And later on, in years' time, what started happening, and I visited many hospitals in Rajasthan and all, there were so many patients in the tertiary hospitals for delivery because they were getting, money paid, that there are 2 or 3 patients per bed. So whenever these things happen, it's impossible for the doctors to, manage things. So what happens? The trends on the society and healthcare professionals, I think you can imagine, and so we can go through that. Negative consequences on the doctors, on the societies. The access to primary care goes on reducing. Among the healthcare workers, there is frustration, demoralization, stress. As you saw, the doctor finally committed suicide, getting scared of that. The performance gets affected. And this is again, another IMA survey told us that 82% of the doctors in India feel stressed out in their profession. 46.3% fear the violence as main cause of stress. 24% doctors fear being sued. 62% of the doctors surveyed are unable to see their patients without any fear of violence, and 57% have thought of hiring security in their premises. So this is what comes to, especially all the doctors' kids. They have started saying that anybody but doctor. I'll go into artificial intelligence. So that's better. Okay. So for the community, of course, compensation claims, unemployment, disruption in family life, social life, and so on. Even the organization suffer. The organization, image suffers. There are disruption in services. We know what happened to Singhania Hospital, totally, burned down, as a violence. So now this is something tangible that we can think of. What can we do? There is, of course, dire need to prevent, make the facilities safe, and all of us have to think how we can, do that. So healthcare professionals become reluctant to handle serious patients, and this is happening now. If something a little beyond, they will, previously one used to manage the patient, even if the patient is very serious, do whatever you can immediately. But now patients tend to be, referred more, and the society is the loser. What can the government do? A lot of things. First of all, they have to accept that, workplace violence is important, and this should not happen in healthcare situations. At least collect the data statistically, see what are the causes, talk to the healthcare workers, and there should be zero tolerance for violence, and we all have to, act in that direction. And we'll discuss about the, one of the resolutions or a bill which was brought in, but didn't see the actually light of the day, hasn't seen it till now. But the recent judgment, that Jorat, the Assam doctor I told you, the court there actually showed spine, and the perpetrator, the chief perpetrator was, death by hanging was the punishment announced. So something like that, if the judiciary starts doing a little dawn on people that no, they can be held responsible and consequences will be there. What can the employers do? Again, now we have corporate employers, we have, big hospitals. And again, the hospitals have to have policies. They have to have, plans. They have to have adequate insurance, not only for the hospital, but for the, individual suffering. They have to consult their doctors and basically promote awareness, not only amongst the doctors, patients, but also community at large. Then healthcare workers themselves need to contribute. They have to again be aware and take steps, learn, get themselves trained, as we'll discuss a bit later about this. What can the professional associations do? At least again, they can make the community aware, and that is what we did. The FIGO, the International Federation of Gynecology and Obstetrics, as a chair of this committee, we brought out a document to make the countries aware, and we sent it to all the international governments that this is not, the healthcare violence is there and it is not acceptable, and laws have to be brought in. Believe me, the many Westerners in my committee initially resisted the idea because they said, no, it's not in our country, it's not such a big issue, so why are you trying to bring it? Finally, they accepted, and finally now it is this particular document has gone to all the governments across the world. Community at large, yes, we have so many active NGOs who work for the patients, work for the community, but they also have to work to see that the violence is reduced, and a lot of things they can do here. Then prevention and intervention. So what can we do as interventions? Again, there can be, as we say in medicine, primary prevention, secondary prevention, and tertiary prevention. Then organizational interventions need to be there, so proper staffing at proper place. And as he was describing, if you look at this, we have to have some intelligent ideas of where the staff is lacking and where, at what situation, the staffing should be better, who should man the particular places. Information and communication with the patients, public. What happens if you are in a large general hospital, you'll find, and if your patient is having a problem which is handled by multiple specialties, you'll find that one specialist will come and talk about only, his own thing. Whatever, say, hematologist will talk about something, then, maybe a diabetologist will come and talk about his own things. The patient's relatives are totally confused about what's happening to the patient. They feel that not one single person is finally in charge. Because you ask something, a patient is having pain, they'll say, that pain consultant will come and tell you, what to do about it and all that. So the treatment is so fragmented that gets the patients frustrated, and that's why we have to look at this when we treat the patients in our hospitals. This is important. We have different codes. There should be this code purple. If violence is anticipated or is about to happen, then there has to be some code where everybody is alerted and the doctor is protected. And this is something now, time has come that we worked on that. And I'll tell you the recent, the example I saw in one of the large famous orthopedic hospitals of one of our teachers in city of Pune only. Two, fighting groups came in, and they're fighting amongst themselves and, about to create violence. They had a code system where they, brought in all their, workers, maushis and mamas and everybody. 50, 60 people of the hospital came and confronted. They just stood with, all the, these maushis in front and, these male workers behind, and formed a huge chain. Immediately looking at that strain of, hospital workers, the parties were quarreling and started quieting down. So you have to have these drills, in the hospital. And I was so happy seeing that somebody is actually, working for it. So premises, there have to be 2 exits. So even if your own hospital is there, make sure that you have an exit, because the first thing is you need to save yourself. Then all the things come, all the other things will come later. There have to be alarm systems. The alarm systems have to be silent alarm system. Otherwise the person will become more aggressive, if you put in an alarm. So all this, like in banks and all they have nowadays, so we have to work on that. So plus, after you press that alarm, there has to be a reliable response system. Otherwise, that doesn't help you at all. So that again has to be, worked on. And the training, there has to be, actually people have to be trained to see how you are going to handle the violence. Preparing a core group of mature and specially competent staff and workers representatives who can take responsibility for more, complicated interactions, like patient is very serious, suddenly patient has become serious, on table, surgery is going on. These are the situations where the seniors have to be roped in, and they have to also help in facing the issue. Then, of course, not only at the event, but after the event, a lot of things happen, especially the person who has suffered. Many times they're so depressed they don't feel like again, entering the hospital, want to quit the practice. So psychological help, rehabilitation help, everything is important in this situation. Well, individual intervention steps. So what can you do as a doctor for yourself? So first of all, remember this, do not overreach. Look at your capacity, look at what you can do, look at what your hospital can do, and only do that much that you can. Don't go overboard by, promising or doing things that you're not able to manage. Then consent. Don't think that it is just a formality. The consent nowadays, the Supreme Court has also given the detailed direction, and it has to be absolutely proper and correct, and give time, because that is something, that is a kind of communication that really helps later on if you have taken the, into account all these issues in the consent itself. Of course, documentation, very important, because minute the violence and all occurs, police will come, take away all your papers, and you will have nothing to show. So proper documentation, on-time documentation, and also keeping copies of that is important. Communication, again, improving, we just talk about improving the communication skill, it's again. Then be alert. Remember the situation. If a mishap has occurred, if you know that the patient or relatives are not going to be happy, first be alert that, well, violence may occur, and create a team. Don't go and face the whole crowd of people alone. Take your your co-workers and along and be there. So be alert about the violence itself. Okay. Then there should be standard procedure. Suppose a violence is to occur, as I said, what response, who is going to do what, this should be worked on. There should be mock drills also. If you have fire drills, if you have treatment drills, why not drill to save yourself? So these drills have to be, worked on. And quick response teams, the professional organizations can come in. We have, and quick response teams created here in the city of Pune with the retired police people. If you pay them a little bit, a retainer, they're happy, they're retired, they know how to handle the mob. And there is a group of people who are working for it. So, those are the kind of people who they are ready to take calls and come to the hospital if required. So even small hospitals can, avail of these steps. First, and these are the immediate steps. First, save yourself. Do not meet anger with anger. Remain calm. Depute, someone. So all these steps are, measured steps which need to be taken in these situations. Inform your lawyer, inform police immediately. By the way, always be good to police people around you. Give them free services. Go to the police stations. That helps a lot. Right? Do not try to settle the issue by paying hush money or because that is like accepting your fault. So that gets you in more trouble than solving your problem. Well, can finally be there a possibility of legal deterrence? Now let's see where the legality of all this stands. So these are the various judgments. In Jammu Kashmir, judgment in this Usmail and others, the High Court of Jammu Kashmir pointed out that such violence highlights dangerous consequences like the spread of infection, imperiling healthcare professionals, damage to public, that is violence they are talking about. And all this started happening during COVID, because I think judiciary and everybody realized the importance of healthcare workers, mainly during COVID issue. So even the Apex Court came up with the idea that the doctors and healthcare workers must be given protection. That was in this Gerald Bennett case. All right. Okay. Again, in this, the Kerala High Court observed that apart from subjecting doctors to agony and anguish, attacks and violence on them adversely affect the treatment of all the patients. So finally, everybody is waking up to it, and that's a good sign. And this was the, one kind of a healthcare bill which was to come. In 2019, it was proposed, and it criminalized the both commission and incitement to commission of violence against healthcare professionals and damage to the property of clinical. However, it never saw the light of the day. The bill was stalled, citing reasons that existing provisions under IPC already covered the elements of violence, and so this comparatively a good bill, but was not passed. Then then came the epidemic. Then again, everybody woke up. Then the old act, Epidemic Diseases Act was actually, brought out, and then this amendment came in. And this amendment was quite good for the doctors. But again, was it a fair amendment during the epidemic? It was fair because something drastic had to be done. But there was, provision. Presumption to be guilty of the offense unless proved otherwise by the accused and defendant. So again, it was opposed, and then people said, no, we need a balanced approach. You can't say, ki, or accused or presumed to be guilty, that is something that judiciary cannot accept. Now what has happened recently, after all this violence, the IMA has gone with writ petition to the Supreme Court. What they are asking is to decriminalize any harm done in line of treatment for the doctors. I think, always what we ask for and what we are going to gain, we have to think twice, because the same thing we did, and I was at the forefront at that time where we were talking about CPA, and we had mentioned, asked for modification of CPA, that Shanta case, that let there be medical tribunals who will decide rather than, judiciary deciding. Maybe at that time it would have been accepted, but that time also IMA said, no, we don't want CPA at all to be applied. The Supreme Court threw out this. So again, I think, unfortunately, if they insist on this, I don't think the Supreme Court is going to say, because, there can be criminal action by the doctors also. So you can't say that, decriminalize all the healthcare thing, but we have to ask for proper, modifications as required. This is a better suggestion by, Neeraj Agarwal's group, that, if violence is there and then the patient goes with a complaint against the doctor anywhere, all the spora, because violence was there, they should reject that. They should not, take it into account. I think that's a better suggestion to avoid the violence at least, So that's something that we can think of. Then can we propose a will? So thinking about what we can do, yeah, we can take help of what the Supreme Court has already said. In Jacob Matthews' case, Supreme Court actually came out with its own guidelines, and it wanted the government to actually act on those guidelines and create an act. Well, partially that was done in NMC Act, but it's only partial. So again, we have to go to the Supreme Court, and this is the right time to do so, and say that you only said that, these things should be applied and implemented. So if we go out to the Supreme Court with this kind of, argument that, see, you have only said that 304A, which is applied, if it is to be applied to healthcare workers, it needs to be modified. How can that be modified? That yes. So how can, what the Supreme Court says here, that if it's an act of negligence or act of rash or negligence act by the doctor, if the doctor is to be arrested, it has to be a gross negligence, not just simple. And this is sadly even our, many of the expert committees don't understand. Many times, the expert committees are, put in place for arguing the case of a doctor, from many government hospitals and medical colleges. And what happens? They find, oh, the signature on the consent was not proper, or this paper was not written properly, so that means the doctor was negligent. What are we are talking about arrest of a doctor. So it has to be a gross negligence, and that even our expert committees have to know, that they have to only opine whether it's a gross negligence or not. They are not supposed to that let the judiciary decide anywhere in CPA or whatever, all these small things that are there. But the expert committees, because they are asked for arrest of the doctor, they should only look at gross negligence, if it at all there, and that is what is said by Supreme Court itself. So whatever the Supreme Court has actually offered us, our expert committees do away with it. And that's the sad part of the story, and that's why we have to, Then what about the law against the violence? Yes, we can act, we need a central act, but not just central act, but IPC needs to be only if you make an act and if the police don't know that. So IPC, the Indian Penal Code has to be also modified there. The problem of the present law is that the violence has occurred, doctor files a police complaint, and simultaneously the patient and relatives also file complaint. Finally, what happens? The doctor is scared, there is a compromise, and when the other leaders and all are fighting in the court of law, the doctor has already settled the case with the patient, and nothing goes forward, and those leaders who are also fighting for the doctors, they fall flat. So if on providing proof of violence, any complaint of alleged negligence by the patient party could be declared void ab initio, automatically this will act as a strong deterrent in future incidences. And again, the whatever is said in Epidemic Act, at least partially modified, should be there. That presume if the violence is there, why not presume? Let the people who have created the violence prove their mentality rather than other way around. So onus of proof should be on them, and there should be punishment for which they have to pay. If they can't pay, the Revenue Recovery Act is there which should be used. So this is the kind of action. If we ask, I'm sure the judiciary will also appreciate it and act on it, but we all have to go ahead and start doing it. So in conclusion, violence against the doctors behoves, of course, ill for the society. It is important for all medical practitioners to be aware that this can occur and they need to take steps to prevent it. Doctors need to pressurize the government to equate assault on a doctor with assault on a public servant on duty. Necessary changes should be made urgently in IPC and Criminal Procedure Code to have a different effect and prevent future incidents of violence against doctors. However, for this to happen, a coordinated effort is needed. Let's hope no more healthcare personnel lose their lives to violence before action is initiated by their associations and the government. And let's hope that this situation doesn't come any further. Okay, so to avoid this, we have to coordinate ourselves and act fast. Otherwise, pretty soon, this is what you will be saying, outside your operation theater. Thank you very much for your attention.
Thank you for the very insightful session, sir. Now, the session is open for questions.
I think everybody is hungry and want to go for lunch. Okay, good.
Thanks for your very detailed class, sir. I can add one more point with that, sir.
Sure.
One is lack of protocols at the ground level in many of the hospitals in our country.
Correct.
Lack of uniformity in the treatment of many cases. According to the patient, any appendicitis is appendicitis, but it is not so for many of the surgeons. And I think the most important point is lack of unity among the doctors in our country. And
Quite
what is
right.
your views?
I think that is very
in
important.
improving in all these aspects?
First of all, we have to unite. We know there are pathies in our branches, but they are there and they are going to be there. So first of all, I have always requested the people from IMA and from other pathies also. So as doctors, let's unite. There are so many things that we need to do together, and unless we come together, then only we can pressurize the government into acting. Here what's happening is, in PCP and DT Act, I found, and sorry to say that, Mr. Dr. Radiologist, that radiologists were acting against gynecologists, in our country. Then, of course, IMA going against, Ayush people and all that. This is not the way we can ever achieve unity, and this is not the way we can ever achieve what we want really, So I'm glad you said that, yes, we have to have the unity, we have to come together, no matter what pathy it is, for some reasons at least, to save our lives now, we have to come together. Please.
Excellent lecture. I really appreciate.
Thank you.
It's a very difficult field to deal with, and you've obviously done a lot of work. You were talking about having a doctor to cure the ailing society, which is absolutely correct. I just have one thought on the primary prevention part, and would like your opinion as well. One of the key method to prevent this kind of violence, especially when people are in rage, is not the fact that you have these laws because they are all protocols, everything is thrown out when the rage happens. Especially it's a mob and a rage happens and you attack. But communication skills is very important for any doctors, and that has been lacking in our system.
Yes.
So one suggestion, if I may, is have a chapter on communication skills or why violence happens, maybe we can start at a grassroots level like medical education. Because as far as I know, medical education has not changed much since the last
No,
2 decades.
I think.
So Symbiosis may be a perfect institute to start
yeah, but-
this
but the
communication skills or the soft skills.
No, but
what we
recently,
call.
even the MCI has come out with new education system, and where initially only these things are taught, and Dr. Zamkar
I think,
and Dr. Natarajan will,
We are absolutely right. When we were learning MBBS, no teacher taught us about communication skills. In fact, there was no communication between us as well. And my basic hypothesis is 50% of violence is because of communication skills.
because of.
Communication skills.
Yeah, of course.
We are never trained. Even if we are asked to explain, we start talking in medical terms. PO2 कमी आहे, हे जास्त आहे, अरे त्याला कसं कळणार आहे? Now everything has changed. Now we have something called as a foundation course, where there are protocols to be taught, communication skills, how to deliver bad news. Now, as MUHS Vice Chancellor, we took first primary efforts that we had in communication skills incorporated in all medical colleges in across all MBBS. And because we are all exam oriented, so in a long case, there are 5 marks given for communication skills. So I think that's how we are. And now NMC has come with a big thing, and I think now the future of doctors won't be hit by for lack of communication skills.
Right.
Good evening. I have a question here, this
Where
side.
are you?
On your right.
Oh, okay.
Yeah, let me introduce myself. I am Advocate Nikitesh Kotangre, practicing at Bombay High Court.
Okay.
I am dealing with 2 cases of medical negligence, one on the side of the victim and another on the side of the doctor. Both are different.
Lawyers
I won't.
always manage that.
Yeah, I won't reveal the details. But I have a question, that is, how do we define the gross negligence? The reason is because in one case, he's a private practitioner and he's made a scapegoat by your own association. That is the reason the case of medical negligence under Section 304A of IPC has been raised. So how do we define this gross negligence? Because we are advocates, we don't understand the medical terms. We have to learn those and then we have to fight the case for him.
Okay. I'm glad
In
you
the-
accepted that,
In the purview of judiciary, we can fight it, but how do we fight in the association?
That's where we always feel that there have to be, expert committees of doctors who will, because in every case that gross negligence will change. There are so many branches and so many things, and the expert group of doctors, a panel of doctors will be able to decide in that particular case whether it is to be called as gross negligence or not. And so that's where the help, even now the Supreme Court has also said, the NMC Act is also saying that call at least 2 specialist doctors and take their opinion. Because in every single, there is no generalization. In every gross negligence, one can at the most say that, what you call of res ipsa loquitur cases, operating on the wrong limb, leaving, sponge inside. These are they can be taken as gross negligence. But other than that, it has to be a doctor's panel who decides in that particular case.
Thank you.
Sure, sure.
There is something which has to be defined. One specialty doctor, like a surgeon operating on a gynecology patient, is gross negligence. This cannot be disputed. This is what even our courts are saying, everything is saying. So, yes, small points about gross negligence can differ from case to case. But if a doctor operating under influence of alcohol is a gross negligence.
Yeah.
Like this.
See, but
Sponge has been left.
again
but we
the-
cannot,
again I'll tell you
that
why-
is what happens when
again
we
I'll
go
tell
to
you
law.
why
because the advocates are always like this.
No, but
And
I'll
sir,
just I'll tell you what you said. Suppose that there is a small town, only one gynecologist, one surgeon. The gynecologist has gone out somewhere for whatever reason, or ill or something.
yes.
The patient has to be, a cesarean section has to be done. The surgeon comes and does it, or he says, no, I can't change my. So it depends on the locality rules, locality things. So it changes from case to case and situations to situation.
So then we cannot say anything about gross negligence.
No, we can. We can still.
What do you think is gross negligence according
As
to
I
you?
said, racists are locator cases, so.
That is the only cases that.
That's probably the only, that's why, because we are talking of criminal negligence here.
So, okay, sir. The criminal negligence. Another thing about the increase in cases of negligence is because of disparities between government and private, and no representation from private hospitals. All the committees, everything that is made. Let's take a doctor from AIIMS. Let's take a doctor from here. What about the private hospitals? Mostly government hospitals have. We all have worked in government hospitals. We are now working in private hospitals. So what they should be is a perspective from the private hospital. Also, that should be put towards the government.
But
That is
will-
not happening.
I absolutely agree, but when will that happen? If we are all together,
Yeah.
we show unity, tell the government, see all this, faculties, branches, pathies are together and we want these things. See, I'll tell you, abroad what happens is, when this, you are a gynecologist, you said, the HRT, that study came, study came, and HRT was to be banned. I was in Canada at that time. The Canadian government asked the Gynec and Obstetric Society, what we should do. And then they opined certain things, and then the government took action on that. Does it happen here? Never. It can never happen here. Because who are they to ask? What do they? So our societies, our professional societies have to also really reach those professional standards. Then only we'll get representation. Sad to say, I was on MMC. As you know, I was on MCI, but I still feel that we also have to show a lot of improvement before we can, when we go and ask. Otherwise, nobody is going to just offer us things, on platter. Because everybody, even in the government, if you see, and that again I've seen at the highest level, there is always, a sort of a dispute between technologists and the, technocrats and the administrators. So IAS officers will always try to, overtake the technocrats in the system. So there are a lot of issues there. But what is important is our unity. Let's start with that.
Yeah, thank you.
Thank you so much, sir. I would like to request Dr. Arun Jamkan, sir, Distinguished Professor, SIU, and Advisor, SMCW, and Symbiosis University of Hospital Resource Center to felicitate Sanjay Gupte, sir.
Thank you.
Thank you, sir, for sharing your time and knowledge with us. With that, we come to an end of the pre-conference symposium of the day. We would now invite you for lunch, which has been arranged at Symbiosis Medical College for Women Courtyard. There are 3 exits in the auditorium, 3 at the front and 1 at the back. So delegatories are requested to use their exit proximate to them. I also request the delegates sitting at the balcony to use the exit at the top for convenience.